What is the primary function of the respiratory system? Answer: the primary function of the respiratory system is to facilitate the exchange of oxygen and carbon dioxide between the body and the external environment. Which structures make up the upper respiratory tract? Answer: the upper respiratory tract consists of the nasal cavity, pharynx, and larynx. What is the purpose of the nasal conchae? Answer: the nasal conchae are responsible for increasing the surface area inside the nasal cavity, promoting air turbulence, and aiding in the filtration, warming, and humidification of inhaled air. Which structure separates the nasal cavity from the oral cavity? Answer: the palate, specifically the hard palate, separates the nasal cavity from the oral cavity. What is the function of the epiglottis? Answer: the epiglottis is a flap of cartilage that prevents food and liquid from entering the trachea during swallowing, directing them towards the esophagus. Which structure contains the vocal cords? Answer: the larynx, also known as the voice box, contains the vocal cords. What is the role of the trachea? Answer: the trachea serves as the airway passage that connects the larynx to the bronchi, allowing air to enter and exit the lungs. What keeps the trachea open and prevents its collapse? Answer: the trachea is reinforced with C-shaped rings of cartilage, which help keep it open and maintain its structure. How many lobes does the right lung have? Answer: the right lung has 3 lobes, the upper, middle, and lower lobes. How many lobes does the left lung have? Answer: the left lung has 2 lobes, the upper and lower lobes. What is the term for the smallest functional unit of the lung? Answer: The alveolus, plural, alveoli, is the smallest functional unit of the lung where gas exchange takes place. What is the purpose of surfactant in the alveoli? Answer: surfactant is a substance produced by the type II alveolar cells that reduces surface tension within the alveoli, preventing their collapse and promoting efficient gas exchange. What is the role of the bronchi in the respiratory system? Answer: the bronchi are the main airway passages that branch off from the trachea and deliver air into the lungs. What are bronchioles? Answer: bronchioles are smaller airway branches that arise from the bronchi and further divide to deliver air to the alveoli. Which muscle is primarily responsible for inhalation? Answer: the diaphragm is the primary muscle responsible for inhalation. When it contracts, it moves downward, increasing the volume of the thoracic cavity and allowing air to enter the lungs. What is the role of the intercostal muscles in breathing? Answer: the intercostal muscles, located between the ribs, assist in the expansion and contraction of the chest during breathing. What is the term for the process of gas exchange between the lungs and the bloodstream? Answer: the process of gas exchange between the lungs and the bloodstream is called external respiration. Which blood vessels carry oxygenated blood from the lungs to the heart? Answer: the pulmonary veins carry oxygenated blood from the lungs to the heart. Which blood vessels transport deoxygenated blood from the heart to the lungs? Answer: the pulmonary arteries transport deoxygenated blood from the heart to the lungs for oxygenation. What is the role of the respiratory center in the brain? Answer: the respiratory center in the brain regulates and controls the rate and depth of breathing to maintain appropriate levels of oxygen and carbon dioxide in the body. What is the term for the process of breathing out or exhaling? Answer: the process of breathing out or exhaling is called expiration. What is the term for the process of breathing in or inhaling? Answer: the process of breathing in or inhaling is called inspiration. Which nerve stimulates the diaphragm to contract during breathing? Answer: the phrenic nerve stimulates the contraction of the diaphragm, causing it to descend and initiate inhalation. What is the function of the pleura? Answer: the pleura is a double-layered membrane that surrounds the lungs and reduces friction during breathing. What is the term for the volume of air that remains in the lungs after maximal exhalation? Answer: the residual volume is the volume of air that remains in the lungs after maximal exhalation. What is the role of the cilia in the respiratory system? Answer: the cilia are hair-like structures that line the respiratory tract and help move mucus and trapped particles out of the respiratory system through coordinated beating motions. What is the purpose of the mucociliary escalator? Answer: the mucociliary escalator is a mechanism in which the coordinated movement of cilia helps propel mucus and trapped particles upward and out of the respiratory tract, clearing the airways. Which lung is slightly smaller and has a cardiac notch to accommodate the heart? Answer: the left lung is slightly smaller than the right lung and has a concave indentation called the cardiac notch to accommodate the heart. What is the term for the inflammation of the bronchial tubes? Answer: the inflammation of the bronchial tubes is called bronchitis. What is the term for the sudden constriction of the bronchioles, leading to difficulty in breathing? Answer: the sudden constriction of the bronchioles is known as bronchospasm, and it often occurs in conditions such as asthma. What is the purpose of the respiratory mucosa? Answer: the respiratory mucosa lines the respiratory tract and produces mucus to trap particles and humidify the inhaled air, protecting the respiratory system from irritants and maintaining optimal conditions for gas exchange. What is the term for the process of gas exchange within the tissues of the body? Answer: the process of gas exchange within the tissues of the body is called internal respiration. What is the role of the carina in the respiratory system? Answer: the carina is a ridge of cartilage located at the bifurcation of the trachea into the left and right primary bronchi. It helps maintain the stability of the airway and promotes the clearance of mucus through coughing. What is the function of the alveolar macrophages? Answer: alveolar macrophages are specialized immune cells present in the alveoli. They help to engulf and remove foreign particles, microorganisms, and cellular debris, playing a vital role in lung defense. What is the term for the volume of air that can be forcefully exhaled after a normal exhalation? Answer: the volume of air that can be forcefully exhaled after a normal exhalation is called the expiratory reserve volume, ERV. What is the term for the volume of air inspired or expired during normal breathing at rest? Answer: the volume of air inspired or expired during normal breathing at rest is called tidal volume, TV. Which structure branches off from the trachea to enter the right lung? Answer: the right main bronchus branches off from the trachea to enter the right lung. What is the term for the process of coughing up mucus or other substances from the airways? Answer: the process of coughing up mucus or other substances from the airways is called expectoration. What is the function of the respiratory system in maintaining acid-base balance? Answer: the respiratory system helps regulate acid-base balance by controlling the levels of carbon dioxide in the body. By adjusting the rate and depth of breathing, the respiratory system can help eliminate excess carbon dioxide, regulating the pH of the blood. What is the term for the accumulation of fluid in the pleural cavity? Answer: the accumulation of fluid in the pleural cavity is known as pleural effusion. Which condition is characterized by the collapse of a lung or part of a lung? Answer: the collapse of a lung or part of a lung is known as atelectasis. What is the purpose of the pulmonary surfactant in the alveoli? Answer: pulmonary surfactant is a substance produced by the type II alveolar cells that helps reduce surface tension within the alveoli, preventing their collapse and promoting efficient gas exchange. What is the term for the process of bringing air into and out of the lungs? Answer: the process of bringing air into and out of the lungs is called ventilation. What is the term for the structure that separates the two lungs in the thoracic cavity? Answer: the mediastinum is the structure that separates the two lungs in the thoracic cavity. What is the role of the hearing-brewer reflex in respiration? Answer: the hearing-brewer reflex helps regulate the rate and depth of breathing by inhibiting inspiration and promoting expiration to prevent overinflation of the lungs. What is the term for the inability to fully expand the lungs or a reduction in lung volumes? Answer: the term for the inability to fully expand the lungs or a reduction in lung volumes is restrictive lung disease. What is the function of the vocal cords in the larynx? Answer: the vocal cords in the larynx play a crucial role in speech production by vibrating and producing sound when air passes through them. What is the term for the movement of air in and out of the alveoli during breathing? Answer: the term for the movement of air in and out of the alveoli during breathing is alveolar ventilation. Which respiratory structure is shared by both the respiratory and digestive systems? Answer: the pharynx is a structure shared by both the respiratory and digestive systems, serving as a pathway for air and food. What is the term for the inflammation of the lungs, typically caused by infection? Answer: the inflammation of the lungs, typically caused by infection, is known as pneumonia.